Hi, my name is Carla Gorman, and I chose to do my paper on free healthcare. I chose that because I currently work in the medical field. I work at St. Mary's Hospital in Madison, Wisconsin. I see several people hesitate to come in and get health care that they need in order to survive and things that they might need for school or other circumstances or just their normal well-being. A lot of people that come in and end up in the hospital have extravagant healthcare bills and they don't know how to pay them off, and they have a hard time paying them just in general, even by making payments. A lot of people choose to avoid taking their children to the hospital because they can't afford it, so they try to look elsewhere for home remedies or something when they should be taking their child in to be seen before it gets to the point of where it's so severe that they need to be hospitalized or worse. It personally affects me because I have some family members that are unable to afford healthcare insurance. For example, my sister had my nephew home today and he was running a fever, but she knows if she takes him to a hospital or a clinic that she's going to be charged a crazy amount of money for a simple antibiotic, which in all general may not cost that much compared to what it would be if she chose not to take her child to the doctor and escalates to be further. Also, it kind of hits home too because my niece also does not have health care as well, and she could not participate in sports because her mother couldn't afford to get her the correct sports physical. There are free places that you can go to, but they're not quality care, and a lot of them cannot get you in because there's such a demand for affordable health care that is not provided by the United States. So anyway, I'd like to get my presentation started. Like I said, I chose why there should be free health care. In the United States is one of the only places that the government has never provided universal coverage for anyone in the country. Meaning, if you're a U.S. citizen or a citizen of wherever you're living, a lot of places will provide free health care for the people of their country. The United States does not currently do that. What the United States does provide now is a system where you can have private insurers and some other things that you can purchase yourself or that is provided by your work or whatnot. The problem with that is people can't afford to pay it. It's very expensive per month. I know my mom works in an insurance company, and just per month it's $500 for family. That's crazy. Plus you have to pay the stuff out of the pocket, and when you go to the doctor and everything, and you still have to pay for prescriptions. This affects a lot of the lower middle class and even the middle class itself because they don't make enough money to cover the costs per month, or like I mentioned earlier, out of pocket like everybody else. They make just enough, to make ends meet, and they don't have enough, to pay for the medical expenses. And the people that do have are able to afford insurance currently face the problem of having to pay overpriced hospital fees to compensate for the uninsured people that go there to make up for the loss of money. Right now, there is Medicaid and Medicare for people that are over 65 in the elderly population that make under a certain amount, and Medicaid for the people that are below poverty level. But this still leaves so many people that are just above those qualifications that are not still unable to afford their health care insurance. So maybe somebody's only making $50 over for what they can qualify, but they still get denied. There's about a third of Americans without health insurance today, and it's being close to the cutoff line for people to be able to qualify for the help. I don't think that the citizens of the United States should have to suffer for this. I think that if you're a citizen of the United States, then the government should be able to help you out. Each person would be treated fair if there was universal health care, as far as if you would come to the office for a medical treatment or even to stay in the hospital, you would be treated equal because everybody would have insurance. They wouldn't be favoring somebody who had insurance versus somebody who does not. And some people say if there's free healthcare insurance, then would they be lazy and not wanting to work? I don't think that that would be true necessarily. I mean, there's already people that do that anyway. I don't know, it might up it a little bit, but I really don't think so. I also think that if people are healthy, then they are able to work and they're able to go to school. They won't spread, diseases wouldn't be spread around so easily, and people would be more productive in their lives. People would also not be suffering from little things like that are very treatable, like strep throat, which strep throat can turn in, if it's not treated, it can be easily spread. It's highly contagious. It can turn into scarlet fever and even cause death when it could be cured by a simple penicillin. Like I mentioned earlier about my niece, she couldn't do her sports physical because my sister couldn't afford it. However, that doesn't just do for school physicals or whatever. It also goes for, like any immunizations that they may need to be in school. And if you do have to pay out of pocket, a lot of times if you go to a pharmacy, it's cheaper than going to the actual clinic or hospital, but they're still very pricey. So you can get pneumonia shot and the flu vaccination, I know at Walgreens here in Wisconsin. And but they're still anywhere from $30 to $70. Some people don't have that. I mean, that's money for food on the table as well. So it's still expensive. If you have healthcare insurance, then you won't have to pay that much. I think it would also help for the medical debt. There is so much medical debt because people simply can't afford to pay off their bills. And if they had insurance, this would already be eliminating that. So I do strongly believe that the government should provide free health care insurance because then everybody would be treated equally, and I think that it would help the medical debt, and I also think that it would help benefit everybody's normal well-being in life, and everybody, it would be easier to make sure that people are healthy and that they could work productively, get an education because they'd be healthy, and so on. So that is my presentation. Thank you so much for your time. Have a good night.